Hi, Dr. Kennedy. How are you today?
I'm good, Janice. How are you?
I'm good, thank you. Can you tell us what the current situation is of COVID-19 in the hospital today?
Yes, as of this morning, we have 3 positive COVID-19 patients in the hospital, all in stable condition. None of these patients are in ICU. We have 52 presumptive cases in the hospital because we did a large amount of testing yesterday with inpatients and other sort of patients and staff who've been exposed to the COVID-19 positive physician. So that's why our presumptive cases are so high. We still have 80% capacity in the hospital, so we still have room to sort of deal with any type of acute emergencies. So we're in about the same position as been over the past couple of weeks with one increase in a COVID-19 patient.
Okay, can we talk a little bit about the possible outbreak, like how it happened and how we move forward from it?
Sure. I mean, these events aren't unexpected, but they certainly do occur. And the difference from this event than other COVID-19, it was a healthcare worker, a physician who has traveled from outside of Northwestern Ontario to provide a critical service. He's a critical care physician, and he does have active privileges. So he really wasn't a locum physician. He has active privileges. Is here. He comes up for regular sort of duties in the critical care department, and he's been on active staff since 2004. He chooses to live both at his home in Thunder Bay, as well he has a home in Eastern Ontario. So, and to the best of my knowledge, he does not work in any other healthcare facility in Eastern Ontario, or he certainly hadn't in the prior 2 weeks before coming up.
Now, I know no one wants to get COVID on purpose. No one does this on purpose, and he's now tested positive. He must be feeling. How is he feeling with this situation?
He's feeling terrible. You know, as a professional and certainly as a critical care physician, he certainly tries to follow all infectious disease protocols. He had no intentions of intentionally sort of spreading this virus to others. The symptoms he experienced were normal symptoms he gets on a regular basis. Certainly not very symptomatic whatsoever. Post-nasal drip, minor symptoms he's had in the past related to other factors. So he had no idea he had COVID-19. I mean, he was keeping active. He had no other symptoms whatsoever. After talking to public health, and his sort of test, even though it was positive, was really a weekly positive test. So again, that's why we have considered this a very low risk exposure, but we still need to take all the special precautions that are required. And that's why we had to, unfortunately, once again, cancel all elective surgery, all elective diagnostics and outpatient procedures. But we are revisiting that over the next several days once we get the test results back of all the patients that we have tested and the staff. And we expect to have, we sent over 150 of these down yesterday and probably over another 100 today. And once we get the vast majority of the results in, we can revisit when we actually begin to increase our capacity for surgery and outpatient procedures.
Do you expect to get the results back in quickly?
Yes, I think we've had arrangements with the Ministry of Health and the Public Health Lab to actually get an enhanced turnaround time within 24 hours. So that's why we should get our first batch of results back later on this evening and sort of a greater batch back tomorrow sometime.
So you mentioned weekly testing. There's words like asymptomatic. Can you explain what those words mean?
Yeah, so as of tomorrow, the Public Health Lab will be up and functioning to do 92 tests a day. That's in-house testing, when they call it in Thunder Bay testing. And also, we at Thunder Bay Regional Hospital have the capacity to do about 160 in-house sort of testing every week. So that really increases our capacity now to do enhanced testing. So we plan to test every healthcare worker here at the hospital who wants to be tested. We also now can actually do all our admissions on a timely basis. Because now, as we said before, we had 52 presumptive cases in the hospital. They take additional what we call PPE, and they also take additional sort of private rooms or isolated rooms. Once we have those testing, we can get turnaround time in 2 to 12 hours. We do not have to use all the PPP, as well as we don't have to do all the private rooms and isolation. So it'll go a long way to help quicker turnaround times, help save the resources in the Thunder Region Hospital. And I said before, all of our presumptive cases have turned back negative. But we're just enhancing the safety of the hospital environment by doing more testing. So every sort of preoperative patient that comes in through the emergency department, every admission, any transfer to long-term care, any transfer to a vulnerable population like the jail or to the retirement homes will be tested prior to discharge, and we'll get a quicker turnaround time.
You know, what about the word asymptomatic? We know if you have symptoms, you're symptomatic. What does asymptomatic mean? Does that mean you have no symptoms at all?
Yes, asymptomatic, you have no symptoms at all, because we are finding with the literature that there are a number of carriers of COVID-19 who have no symptoms whatsoever. Some reported studies say 25%, some say 15%. So it would be good to begin sort of asymptomatic testing in essential workers, which is the police officer, the fire, the first responders, people working as gas attendants, taxi drivers, people working in the grocery stores. So nice to get a sense of if there is any sort of a potential spread in the community, which we have not identified for a good number of weeks, if not into a month. So it'd be good to get a handle on that as we begin to open up businesses.
And the last thing we want is people to panic. And this is considered low risk. So why is it low risk? And should we just reassure everyone that there is no need to panic?
So low risk means many times when you test for the virus, the test will stay positive, but you're not shedding any of the virus. So you're not contagious, but the test will stay positive. So at the stage that we've identified this individual physician suspected had some minor symptoms, by the time he got to Thunder Bay, those symptoms had resolved. And they're just minor symptoms, but even though they had resolved, they still were lingering, and still his point of contagibility was very low at that period of time, even though he tested positive.
Okay,
and also he's wearing PPE during the exposure to the patients the vast majority of the time, so that's why we said he was low risk.
Mm-hmm. Now, we've been dealing with COVID-19 for quite a few months. The hospital's been dealing with it. We don't want to disregard all the hard work that the hospital staff and everybody involved has done throughout this. Is there anything you think that could have been done differently to avoid this situation?
Absolutely. Whenever you have an incident like this, you want to look back and reevaluate what you could have done to prevent things. So I think what we're going to be doing now is, as soon as an individual who's traveling from outside of Northwestern Ontario and part of the healthcare workforce at Thunder Region Hospital, we're going to do a swab the day he or she arrives to make sure they're safe for the workplace. But again, testing isn't the primary sort of factor that you prevent spread. Wearing the PPE, the gloves, the mask, the goggles with any patient contact is the primary sort of area. So testing sometimes will give you a false positive or a false negative. You may be negative at one point in time, but you could be early in your condition and the test swab turns negative, but it could turn positive in 3 or 4 days. So we need a process to be worked out how often we should be doing testing also.
And now you did mention earlier in the conversation that this possible outbreak has affected what will reopen at the hospital. So do you have an idea of when we will go back on track with the openings?
Yeah, so once we get a vast majority of the test results back, as you said, we're doing hundreds of tests right now, and we should get the majority of the test results back tomorrow and over the next 2 or 3 days. Once we're seeing them all coming back negative, and we can sort of reassure ourselves that the environment is still safe, then we can have a meeting with our IMS structure and recommend going back into sort of the 25% increase in volume of surgery and outpatients soon. So I'm thinking hopefully mid next week, if everything plays out right, I'm hoping we begin to increase our volume of outpatient, non-essential sort of elective surgeries.
Well, hopefully next week when we chat, that's what we'll be talking about, is what will be opening up at the hospital.
That is my dream, actually.
Perfect. Dr. Kennedy, thank you so much for talking with us.
Okay, anytime, Janis. You take care.